My name is Michael Porcaro, and I proudly serve the people of Vernon as their town administrator and emergency and risk management director. On behalf of Mayor Champagne and our entire town council, it is my distinct pleasure to welcome Governor Lamont, Public Health Commissioner Dr. Juthani, and all of our distinguished guests to the town of Vernon, or we like to think of it as the best small city and large town in the state of Connecticut. Why is Vernon so great? Let me tell you, Governor. We have great schools, safe neighborhoods, good jobs, the best trail system in Connecticut, beautiful and cherished open and recreational spaces, a dynamic business community, a wonderful hospital system, a stable tax rate. We've had no mill rate increase in the past 4 years and counting. One of the best nursing home systems according to U.S. News and World Report, and outstanding municipal services, including a highly respected police department and a treasured EMS and volunteer fire department, which is among one of the largest and most progressive in the state of Connecticut. But if you ask our residents what makes Vernon really great at this time of the year, in particular, it's that we still provide our residents with free curbside leaf pickup. But all kidding aside, what makes Vernon truly great is our strong and proud tradition of community service and volunteerism. In Vernon, we recognize that each of us has a unique set of talents and skills that we can use to strengthen and benefit our entire community. A concrete example of what our collective values have achieved is our nationally recognized vaccination program that has served thousands of individuals from Vernon and across the state. Together with our local health district, our hospital system, our school system, we mobilized an army of volunteers. We forged strategic partnerships and implemented creative solutions that focused intensely on breaking down barriers and providing access to life-saving vaccine for all people who wanted to be vaccinated, especially the hardest to reach and most vulnerable and underserved populations in our region. None of this would have been possible without the support and leadership of Governor Lamont and the incredible staff at the Connecticut Department of Public Health. So thank you, Governor, and thank you, Commissioner, and your staff for supporting us in this effort. Today, the focus is on booster shots. As a community leader, as a licensed healthcare provider, as a first responder, as an elected official, as a former state public health official, as a former school board leader, and most importantly, as a parent, my message today is simple. Vaccines save lives. And with that, it's a pleasure for me to introduce Deborah Weymouth, the CEO of Eastern Connecticut Health Network. Deborah.
Good morning, everyone, and thank you for being here. What a beautiful day. I have the high honor and distinct privilege of welcoming the Honorable Ned Lamont, our governor, to Eastern Connecticut Health Network and Rockville General Hospital. I'd also like to welcome the many other elected officials, Eastern Connecticut Health Network leaders, caregivers, physicians, and members of the community who are joining us this morning. As stated, my name is Deborah Weymouth, and I serve as the President and CEO of ECHN. Governor, on behalf of everyone here, I want to thank you for your efforts and quick response to the COVID outbreak. You've kept us informed and motivated through your websites, daily updates, hotlines, interactive graphs, and much more. We responded to your call, and the results speak for themselves. Throughout the pandemic, Connecticut has remained one of the top few states in vaccination rates, fewer uncontrolled surges, and fewer outbreaks. We all responded to your call. Eastern Connecticut Health Network continues to be a proud partner with the town of Vernon and Rockville in the delivery of vaccine to this community. The cooperation and partnership that we have developed will stand us well after this pandemic is under control. It is reassuring to know that we have communities like Vernon to step up, take action, and genuinely support their community. My special thanks to Mayor and Senator Dan Champagne and his team. Rockville General Hospital celebrated its 100th anniversary just a few short days ago. In those 100 years, the constant has been great people who cared. Now, as we attempt to recalibrate and move forward, we all owe the people in the building behind me, at Manchester Memorial, at every hospital, practice, clinic, ambulance team, police force, and many other sites of first responders and essential workers a great deal of gratitude. Their commitment 24/7, 365 was not only commendable, but it is amazing. As they continue their devoted careers in caring for others, my hope is that they too feel the pride for answering that call. Please join me in a round of applause to thank Governor Lamont, the town of Vernon, and the caregivers everywhere for their work in addressing COVID-19. And I am proud now to introduce the Chief Medical Officer of Eastern Connecticut Health Network, Mr. James Castellone.
Thank you, Deborah, and thank you, Governor Lamont and Commissioner Giuttani, for being with us today to encourage COVID-19 vaccinations and specifically the booster for the COVID vaccine. We know vaccines prevent illness and death, yet we recognize that people may have concerns about receiving the vaccine or feel they don't need to get a booster. Vaccinations have historically proven to be effective. In fact, as a global community, we eradicated smallpox virus due to vaccination. That alone demonstrates the power of a community, a country, and a world who work to protect themselves and everyone else around them by getting vaccinated. We can reflect on this and other scientific studies that uphold this same effectiveness of vaccines. In the United States, there have been over 400 million vaccine doses already given. This vaccine and the booster are highly effective in reducing the risk of severe illness, hospitalization, and death. Since the start of the pandemic, there have been 786,000 deaths in the United States from COVID-19. And the projection over the next 6 weeks, by the end of the year, is that there will be an additional 138,000 more deaths. The overwhelming majority of these deaths will be in unvaccinated individuals. The vaccine prevents many of these unnecessary deaths, just like many other vaccines that have been developed and are administered every year. We are now seeing breakthrough infections. Approximately 1/4 of hospitalized COVID-19 patients in the state of Connecticut are fully vaccinated. So we're seeing fully vaccinated individuals get COVID-19, particularly beyond 6 months after their vaccination. Boosters are essential to continue to provide immunity, and the experts are determining the best timing for those booster doses and have provided the current recommendations after analyzing the data from the various vaccine trials. After caring for COVID patients and working with members of our medical staff across hospitals and throughout our surrounding towns, I urge you to consider getting the vaccine if you're unvaccinated, or the booster if you have already been vaccinated, to protect yourself and your loved ones. I'd now like to introduce next Dr. Rampal, the medical advisor for the town of Vernon.
Good morning. It is an absolute pleasure to be here, and thank you, Governor Lamont and Dr. Giuttani. In the past 2 years, we've faced enormous challenges as a physician, as a community. As the pandemic has unfolded, as a community physician, I've been worried about my family, my patients, my loved ones, and also for myself. When it became clear a vaccine would be available that offers significant protection against this virus, I was grateful for the science and technology which allows this to happen. It has been an honor of the lifetime to work with Town of Vernon and help lead this nationally recognized vaccine campaign. We have vaccinated thousands of people and saved countless lives. Throughout the effort, we focused on reaching the most vulnerable people. We went to the seniors, we went to people with disabilities, people with autism, people experiencing homelessness and food insecurity. We went into faith communities. We worked with mosques and churches. We worked hard to reach people who were facing challenges in their daily lives. I was so excited when 2 weeks ago I was able to get my own child vaccinated. So it was very, very rewarding for all of us. And to be quite honest, as an ER physician, I never thought I would say this, but it was the best when I was actually able to make house calls to people who could not leave their homes and provide them with this vaccine. The gratitude in those people's faces, the relief of knowing that they were now protected from the virus, that was enormous for me. None of this would have been possible without my supportive staff at Priority Urgent Care, our partners in town of Vernon, and the support and leadership of Governor Lamont and the Department of Public Health. I thank you all. As a young boy, a young person growing up in another country, I grew up in India. I dreamed of a career in medicine. We all think we can make small differences, but when you get an opportunity to make a big difference, to be part of something bigger than yourself, to be part of this wonderful team, it serves to show that what a big team can achieve, what a wonderful team can achieve. We have now moved into a new stage where boosters can help extend the protection offered by the vaccine. Just as vaccines save lives, boosters save lives. Please take advantage of this wonderful vaccine. I implore you, I urge everybody to do so. Please get yourself and your loved ones vaccinated. By working together, we will definitely beat this disease. And thank you everybody for this effort in getting everybody vaccinated.
Thank you so much for the invitation, and it's an honor to be with all of you here today. What a remarkable story of a town that took on the challenge of vaccinating so many people here and in the community. And I want to take a moment just to highlight the healthcare workers in hospitals like this that have been caring for patients with COVID-19. We are going on almost 2 years. It is not going to be that long before we're at 2 years doing this. It is tireless work. Sometimes it feels like thankless work. Again, I want to just thank you all for what you've done. I've been in the trenches too before I took this role. I know what the work is, so thank you for that. We're here to talk about vaccinations and boosters. Just as was said, we know that 75% of people who are getting hospitalized with COVID-19 are still the unvaccinated. If you're on the fence, going into a cold winter with the Delta variant, which is more infectious, take your opportunity to get vaccinated now. For those who have been vaccinated, and I know the messaging has been confusing about who is eligible for a booster. To talk about the confusion, I had an educator ask me if she was eligible. I had a 61-year-old man with diabetes tell me that he was not eligible. I had an owner of a liquor store also think that he's not eligible because that's technically not a grocery store. What is the difference in exposure between being in a liquor store versus a grocery store? There really is none. He was fully vaccinated and he got COVID-19. Luckily, he survived and he's done fine. It was mild illness. He was able to get monoclonal antibody. My point to all these stories is to say all of those people were eligible for the booster up until now. What we know is happening in Connecticut is that we are surrounded by states that are surging with COVID-19. Here in Connecticut today, I can tell you that our positivity rate has gone up and down, but you often look at the map and see how many of our towns look red. We are going from 31 towns that looked red last week to 64 towns that look red this week. They overlap pretty much with our areas that are less vaccinated. What I can tell you is that in addition to that, if you got vaccinated 7, 8, 9, 10 months ago, like I did, since I was first vaccinated in December and January, your immunity is most certainly waning. We have an opportunity to get people boosted here in Connecticut to fight this next wave that is coming in terms of COVID-19. A specific challenge to our healthcare workers and particularly workers in long-term care facilities. We know that we are caring for our most vulnerable. When people come to healthcare, they are at our mercy as healthcare providers. One tool we have on our side this time around is getting vaccinated and getting boosted. And my challenge to many would be, particularly in our long-term care industry, to by December 15th, before we go into the holiday season, have a booster clinic. Get your staff and patients vaccinated. It is the one thing, and particularly boosted this time around, it is the one thing we have beyond infection control measures that we've always had all along to try to protect our patients. So this is my pledge and plea to all of you to please come on board. Do what we can for the people of Connecticut to drive this virus out. We don't want to see a big surge. We won't have as big a surge as we've had in the past because we are so vaccinated. But we can do better. We can take care of each other. We can do what we can to protect our community. And with that, I will turn it over to Dr. and Senator Saud Anwar.
Good morning. Thank you, Commissioner Jitani, for your leadership. You know, it's such a blessing to have a commissioner who is an expert in the disease, as an infectious disease expert, but knows about the disease, but also the management strategy so well. So today I want to talk about the fact that leadership matters. Leadership matters. Why? Because what we are seeing today, or what we are witnessing, the celebration of the success of vaccination program in this community, is because of the leadership. And the leadership starts in the community, where you have volunteers, where you have your community members who recognize that there's a need, and then from there on, the community volunteer leaders take care of that. Then subsequently, the town council, the mayor, Dan Champagne, during the time of the vaccination, it was great to be able to interact with him on a regular basis and talk about the pockets within the community that needed more interaction. And then, of course, with the CEO, Deborah, your leadership, and making sure that the entire hospital system and the team of all the healthcare workers were on board was critical to make this happen. So that's one part of what the community does. The other part of where the leadership matters is at the top. And that's where I can tell you it is a blessing that we have Governor Lamont, who has for the past many months tirelessly, persistently made sure that we did everything that was in our control as a state to make a difference and prevent this illness. In the intensive care unit, when I'm managing patients, by the time they're in the ICU, it's a little late. We still are able to do well. We can do a lot more at that time too, compared to where we were before. But if we can prevent people from coming to the intensive care unit, we have been able to save lives, and that is what this is all about today. So, and I'll share with you, I want people to recognize that we cannot take this for granted, the moment that we are in, the responsibility that we are having to take care of, and the leadership that we have. As an intensivist, as a physician, I interact with people across the country who are doing what I'm doing and learning about them. And somebody made a remark the other day, and I won't tell you which state they were from, but they said, "You guys are lucky you have a real governor." And because the real leadership shows at the time of difficulty, and Governor Lamont, from day one, what you have done is you have taken the actions, you have taken the responsibility, you've taken this virus by the horn. It has many horns. That's why it's Corona. You are able to try and identify ways to take care of this disease and the problems. We have truly saved lives, and with your leadership and action of the boosters, we are going to save many more lives. So honored to be standing here amongst all of the people who have made it happen, and especially you, Governor Lamont. Thank you.
Hey, thank you, Saud, and right back at you. It's kind of nice having folks in the state legislature with a background in healthcare and public health. And Representative Winkler, thank you. The partnership we've had with the legislature has made an amazing difference. I knew I loved Vernon, but free curbside leaf pickup, is that what you said? Free? I love Vernon. I also love, as Deborah said, that this is a town that looks out for each other. And I think that's why we're here today. I think that is why the Center for Disease Control gave a shout out to Vernon, gave a shout out to ECHN for the amazing work they've done in getting people vaccinated. This was nationally recognized in terms of the work you have done. And I'll tell you, we learned along the way. Look, Connecticut was the hardest hit, you know, us, New Jersey and New York, way back a year and a half ago. But we've learned, and the first one we were like this, and the second one was a little bit less, and the third one was a little bit less. Other states haven't learned. We've learned along the way, and that's because we look out for each other. That's because we got tested. That's because we got vaccinated. And we got a little bit of a flare-up, as you heard Manisha say, less in Connecticut than our neighboring states, but if we learned one thing, no community is an island unto itself, and no state is an island unto itself. And that's why we work so closely with our neighboring states, and that's why we got to be extra cautious now. One of the things we learned is not everybody signs up online. You know, I remember back when it was 75 and over, and we made the vaccines available there first and said, all you got to do is go to VAMS and log in and give us your authentication number. Nobody knew what we were talking about, and it was really complicated. And as we've worked harder and harder to get out to underserved communities, disadvantaged communities, elderly, those that need a special outreach, there I think this town has really distinguished themselves. That's why you've been able to get more people vaccinated. And I just got to tell you something. We're, 11 months into the vaccination program. And from my point of view, if you were vaccinated more than 6 months ago, you're not fully vaccinated. You're not fully vaccinated. If you were vaccinated more than 6 months ago, now is the time and go get that booster. I urge you to get it now. Get it so before Thanksgiving, before Christmas, before all those holidays, before we see what's going on in Maine and Vermont, and Rhode Island, and New York all around us, that we'll be ready. And when that next ripple comes, it's going to be the smallest one we've had yet. And what that means is we get through these holiday seasons, nice festivities with our family. We're back in January, and if we've done our job, it's going to be a really new day. We've got the therapies in place. We've got our folks boosted and our kids in school. And that's why I'm proud to be here in Vernon and proud to be your governor. Thanks, everybody.
Well, that concludes our press conference. At this point, we'd be glad to take any questions from the media or anyone in the audience at this point.
Governor, you mentioned that if someone was not vaccinated within the last 6 months, that they're not fully vaccinated. Does the state plan on changing the definition of what you consider fully vaccinated? That's the first part. And the second part is, for all of the vaccine mandates, the people who are under a mandate, are they now going to be mandated to get a booster shot?
At this point, it's voluntary. At this point, I'm saying consider yourself not fully vaccinated if you don't get that booster, if it's been, 6, 9 months. In terms of mandates, we'll figure that out later, waiting to have some commentary from CDC.
But as of right now, there's no thought of having someone who was under a vaccine mandate for teachers, for state workers, being mandated to get a booster.
As you know, I try and do everything with encouragement first before we talk about anything else. But if you're a teacher, if you were vaccinated 8 months ago, you're still going into that classroom every day, now's the time to get your booster.
We're also seeing a pretty big outbreak in Europe, as you know. Is there any thought about travel restrictions from people coming from Europe?
There's no thought about that as yet, but I do look at Germany. I look what happened in Britain going back, now a few months ago. There they had a fair number. In Germany, there were a lot of pockets of people that were not vaccinated. Let's say the majority of people were vaccinated. Those pockets, COVID is like a heat-seeking germ. It goes after those pockets of people, and then it can spread through a community. In Britain, a little bit different. The young were not vaccinated, and the young in the schools were not wearing masks. So you saw a lot of the COVID start in the schools and get into the general population.
One more for you. The commissioner had mentioned that she
Look, I'm with the commissioner. I think it's absolutely something we got to do. We got to get those booster clinics right at the nursing homes. They're taking care of the most fragile people. They were the first ones vaccinated now, going back 11 months in some cases. So the answer to that is yes. EO or not, I don't know. We'll figure that out.
A lot of vaccine providers are still waiting on the CDC to make their, the FDA and the CDC to expand and get a booster shot. Are you telling them not to wait and to follow what other states are doing and just start giving them to all adults now?
Yeah, I think I am. CDC speaks Latin. I can't figure out who's eligible, who's not eligible. If you smoked while you were in high school back in the 1970s, you're eligible. I think if you haven't been vaccinated or in more than 6 months, now's the time to get the booster. Self-report. You're at risk. You're public-facing. You're out there. Get the booster.
Are there any recommendations in terms of mixing brands?
I think CDC has said it's okay, but why don't you take that, Manisha?
Sure. So I think we've gotten guidance that you can mix brands. I mean, that's out there. What I would say in general is that the studies for Pfizer were done with Pfizer. Studies for Moderna were done with Moderna. If we have equal access, you can just stick with the brand that you got in general, but if you don't have access and you get one of the others, that's totally fine. With Johnson & Johnson, what's pretty clear is that after 2 months, your immunity starts to wane. And you can get a Johnson & Johnson booster, but certainly your response in terms of immunity is much higher if you get an mRNA booster, whether it be Moderna or Pfizer. So in general, unless people have a problem getting an mRNA booster, which I have no reason to suggest that, I would say that an mRNA booster would be more likely to give you a stronger boost after a Johnson & Johnson. Correct. Right. I think what's key right now is who's eligible, and we know that that 6-month window, it's very difficult to know exactly and track, other than looking at each person, who's eligible at a given point in time. So over a period of time, it's gonna be everybody get a booster. But because that 6-month window for specifically Pfizer, Moderna, or 2-month window for J&J, it's difficult to set metrics in that way. What we know is that for our oldest age group, if we look at 65 and older, we are well on our way, upwards of about 45% we think boosted in that group so far. But that's the group that would have been eligible earliest, more likely got Moderna or Pfizer. We'd like to see as many people get boosted as possible.
Commissioner, obviously Connecticut is one of the most vaccinated states in the country, but when you look at booster rate, we're kind of close to the middle of the pack, including behind some of the other highly vaccinated states in the Northeast. What do you attribute that to?
I think some of that is because of the confusion that people have had that I tried to highlight on who's eligible. And we know that it is likely that we're going to have additional guidance on that front. But what I can say is that all the states around us are surging. We have more cases here in Connecticut, as we're seeing every day. And this is not an island. People cross state lines all the time. So I would say that we live in a high-risk community of getting COVID-19. So even though these eligibility criteria are confusing, I think people in the state of Connecticut can feel comfortable saying that they live in an area where COVID transmission is on the upward tick at this point.
Yeah, so when the CDC originally authorized booster shots, obviously there was a lot of debate, the FDA and the CDC, about which groups to include, and some people wanted to make it tighter and some people wanted to make it broader. So I guess why do we now feel that it should be as broad as possible when the advisory boards, the advisory panels were kind of on the fence about that to begin with?
One of the things we saw, if you look at Israel's example, is that initially they were very restrictive in the way that they distributed vaccines. And then they started seeing a surge, and then they made it more liberal, and they allowed people to get boosters, and then things settled down. And I suspect we're in a similar type of pattern to what we saw happen there. And I think we are looking to the guidance from the people who made those decisions at the FDA and CDC. And we know that we are getting those guidance in the next couple of days. We know that people are meeting to discuss that specifically. But I think that many of our governors, leadership, recognize that we have an opportunity at this point. We know that people are going to be gathering more over the next several weeks. So this is an opportunity and window to try to make people aware of what the risk is. And particularly, we know the science is showing us that immunity does wane. It doesn't mean that the vaccines are less effective. It just means you need a boost to continue to be effective.
What are we seeing in new vaccinations in recent weeks, and is there any indication that all this talk of boosters and waning immunity is having an impact on whether or not people get vaccinated in the first place?
We are continuing our efforts to work with communities that have not been vaccinated so far. And, you know, I think we made our greatest headway over the last 11 months. This last bit is a little bit more challenging, but we continue to work with a number of different strategies, including outreach to physicians who care specifically for groups of people. Because at the end of the day, for somebody to hear from me is one thing, but if they hear from their own doctor who tells them that because of the situation you are in, I really think this is what's best for you. If you have that conversation with your own doctor 3 or 4 times, there's more likelihood that you are going to go ahead with that vaccination. So that's one of the things that we're actively working on, is working with physicians and other providers who care for people directly in their community, because I think that that's where you're going to listen to the people you trust. That's understandable. So I think we are continuing those efforts. The other thing I would say is we've had very robust uptake so far of the 5 to 11 group. And I'm very proud of the headway we're making there, almost 36,000 vaccinations to date so far in that age group of kids. And we know that that's a group that is socializing and in school and has had some transmission. And the more we can do that, the more we'll be able to protect everybody in the community.
So you said 36,000 total for 5 to 11 gotten vaccinated.
Roughly so far, yes.
And you acknowledged earlier, you know, the confusion surrounding the COVID messaging. What are you doing to try and simplify that and make it easier for people to understand? And do you consider even calling these booster shots part of that confusion? Because we don't call the annual flu shot a booster shot, and it's looking like this is going to be an annual type of vaccine.
I think we recognize that there's been a lot of confusion throughout this course of this pandemic. And the challenge I see is to try to simplify and clarify as much as possible so people can understand. Part of it is because we are learning about this virus as it goes. We are learning about the therapeutics as it goes. We are learning about the vaccines as it goes. And so you're right. Right now we're calling it a booster shot. Is it possible a year from now we're going to say, you know what, you need another one, and it's an annual shot. That is what it is, similar to the flu shot. That's very possible. We just don't have the science to show us that yet. So what we are trying to do is make it as easy as possible for people to understand what it is. We look to the guidance from the FDA and CDC so we can simplify that for all of you, because these are respected agencies with respected scientists who've been doing this work for a long time. We look to them for their guidance to be able to help us in local communities and in the state clarify the messaging for everybody. But what I can tell you right now, and we will await what the final word is from these agencies, is that if you've had your shot more than 6 months ago, your immunity is waning. There is no doubt about that.